Question 1. Benchmark analysis indicates that certified occupational therapy assistants, COTA, often face time constraints in documenting client sessions. Considering the regulatory framework for occupational therapy practice in the United States, which approach to documenting a client's progress and response to interventions is most aligned with best professional practice and compliance standards. Option A. Delaying the documentation of multiple sessions until the end of the work week to consolidate entries. Option B. Documenting key observations, interventions performed, client responses, and any modifications to the plan of care immediately after each session. Option C. Relying solely on verbal updates to the supervising occupational therapist without creating a written record of the session. Option D. Recording only that the client participated in scheduled activities, without detailing specific interventions or responses. The correct answer is B. Documenting key observations, interventions performed, client responses, and any modifications to the plan of care immediately after each session. Explanation. Scenario analysis. This scenario presents a common challenge in occupational therapy practice, balancing the need for comprehensive documentation with the practical realities of a busy clinical environment. The Certified Occupational Therapy Assistant, COTA, must ensure that all documentation meets the established standards for accuracy, completeness, and timeliness, while also being efficient. Failure to do so can lead to regulatory noncompliance, potential reimbursement issues, and compromised continuity of care. The challenge lies in identifying the most effective and compliant method for documenting a client's progress and response to interventions. Correct approach analysis. The correct approach prioritizes the client's immediate needs and the therapeutic relationship by documenting the session's key elements contemporaneously or immediately after the session. This aligns with the ethical principles of beneficence and fidelity, ensuring that the client's care is accurately reflected and that the COTA acts in the client's best interest. Regulatory frameworks, such as those governing Medicare and state practice acts for occupational therapy, mandate accurate and timely documentation. Documenting key observations, interventions performed, client responses, and any modifications to the plan of care in a clear and concise manner immediately after the session ensures that the information is fresh, accurate, and readily available for the supervising occupational therapist and other healthcare providers. This practice also supports timely billing and reimbursement. Incorrect approaches analysis. One incorrect approach involves delaying documentation until the end of the week. This practice poses a significant risk of memory lapses, leading to incomplete or inaccurate entries. It can violate regulations requiring timely documentation, potentially impacting reimbursement and the ability to demonstrate medical necessity. Ethically, it compromises the integrity of the client's record and can hinder effective communication among the healthcare team. Another incorrect approach is to only document the client's participation in activities without detailing the specific interventions, client responses, or any therapeutic rationale. This superficial documentation fails to meet the requirements for demonstrating the skilled nature of occupational therapy services. It can lead to audits questioning the necessity and effectiveness of the interventions, potentially resulting in denied reimbursement and noncompliance with payer guidelines and state practice acts. It also fails to provide a clear picture of the client's progress or challenges. A third incorrect approach is to rely solely on verbal communication with the supervising OT without creating a written record. While verbal communication is crucial, it is not a substitute for proper documentation. Regulatory bodies and payers require a written record to verify services rendered, client progress, and the rationale for interventions. Verbal communication alone is insufficient to meet these legal and ethical obligations, leaving the client's record incomplete and potentially exposing the COTA and facility to compliance issues. Professional reasoning. When faced with documentation challenges, professionals should first consult their facility's policies and procedures, which should be aligned with state and federal regulations. They should then consider the specific requirements of the client's payer. The core principle is to document accurately, completely, and contemporaneously to reflect the skilled services provided and the client's progress. If time constraints are an issue, professionals should advocate for adequate time for documentation or explore efficient documentation methods that do not compromise quality or compliance. Prioritizing client care and ethical practice means ensuring that documentation accurately reflects the therapeutic process and meets all regulatory and professional standards. Question 2. Process analysis reveals that a CODA is working with a 16-year-old client who is exhibiting significant social withdrawal, difficulty forming peer relationships, and a reluctance to engage in group activities, despite demonstrating age-appropriate academic skills. The CODA is considering how to best support this client's occupational engagement. Which of the following approaches best reflects a comprehensive application of developmental theories to inform intervention? Option A. Provide direct instruction on social etiquette and conversation starters, assuming that the client lacks the basic knowledge to engage socially, as per Vygotsky's concept of direct teaching. Option B. Focus solely on cognitive restructuring techniques to challenge the client's negative thoughts about social interaction, as this directly addresses the observable behavior. Option C. Implement structured, solitary activities that allow the client to master skills independently, as this aligns with Pyagot's emphasis on individual exploration and learning. Option D. Prioritize interventions focused on fostering a sense of identity and independence, recognizing the client's stage of psychosocial development, while also considering how their cognitive abilities influence their social problem-solving skills and the potential for peer scaffolding in social situations. The correct answer is D. Prioritize interventions focused on fostering a sense of identity and independence, recognizing the client's stage of psychosocial development, while also considering how their cognitive abilities influence their social problem-solving skills and the potential for peer scaffolding in social situations. Explanation. This scenario presents a common challenge for certified occupational therapy assistants, CODA, in applying theoretical frameworks to client care. The difficulty lies in accurately interpreting a client's behavior through the lens of developmental theories and then selecting the most appropriate intervention strategy. This requires a nuanced understanding of each theory's core tenets and their practical implications for occupational therapy. The correct approach, which aligns with best professional practice for CODA, involves integrating multiple developmental theories to gain a comprehensive understanding of the client's situation. This holistic perspective allows for the development of interventions that address the client's current developmental stage, cognitive processes, and social-emotional needs. This approach is ethically sound as it prioritizes client-centered care and evidence-based practice, adhering to the principles of beneficence and non-maleficence. Regulatory guidelines for CODA emphasize the importance of utilizing theoretical frameworks to inform practice and promote optimal client outcomes. Incorrect approaches fail to adequately consider the complexity of human development or misapply theoretical concepts. One incorrect approach might solely focus on a single theory, leading to a narrow and potentially ineffective intervention plan. For instance, exclusively applying Pyagot's sensor-motor stage to an adolescent experiencing social withdrawal would overlook crucial psychosocial factors highlighted by Erickson. This would be a regulatory failure, as it deviates from the expectation of comprehensive client assessment and intervention planning. Another incorrect approach might misinterpret the core principles of a theory, such as confusing Vygotsky's zone of proximal development with simply providing direct instruction without considering the role of social interaction and scaffolding. This would be an ethical failure, potentially leading to interventions that are not tailored to the client's actual learning capacity and could hinder progress. Professional decision-making in such situations requires a systematic process. 1. Thoroughly assess the client's current functional abilities, cognitive status, social interactions, and emotional presentation. 2. Consider how each relevant developmental theory, Erickson, Pyagot, Vygotsky, might explain the observed behaviors and challenges. 3. Synthesize the insights from each theory to form a holistic understanding of the client's developmental needs. 4. Select interventions that are evidence-based, client-centered, and directly address the identified needs, drawing upon the integrated theoretical understanding. 5. Continuously monitor client progress and adjust interventions as needed, remaining open to re-evaluating the theoretical underpinnings of the care plan. Question 3. System analysis indicates a certified occupational therapy assistant, CODA, is working with a client who has expressed a desire to improve their ability to prepare meals independently. During an initial session, the CODA observes that the client struggles with opening jars and chopping vegetables, suggesting potential underlying deficits in grip strength and fine motor coordination. However, the client's primary stated goal remains being able to make my own dinner. Which of the following assessment approaches would best align with the principles of client-centered care and the regulatory framework for occupational therapy practice in Ontario, Canada, while addressing the observed functional limitations and the client's stated goal? Option A. Utilize a model of human occupation, MOHO, screening tool to gather broad information about the client's occupational patterns and volition, without directly focusing on the client's specific meal preparation goal. Option B. Conduct a standardized fine motor skills assessment to objectively measure the client's grip strength and dexterity, assuming these are the primary barriers to meal preparation. Option C. Develop an intervention plan based solely on the CODA observations of difficulty with opening jars and chopping vegetables, without further assessment or client input on their specific meal preparation goals. Option D. Administer the Canadian Occupational Performance Measure, COPM, to collaboratively identify and prioritize the client's specific performance areas and satisfaction with their ability to perform them, including meal preparation. The correct answer is D. Administer the Canadian Occupational Performance Measure, COPM, to collaboratively identify and prioritize the client's specific performance areas and satisfaction with their ability to perform them, including meal preparation. Explanation. Scenario analysis. This scenario presents a common challenge for certified occupational therapy assistants, CODA, where a client's self-reported goals may not fully align with observable functional limitations or the therapist's professional judgment regarding potential areas for improvement. The professional challenge lies in balancing client-centered care with evidence-based practice and the ethical obligation to provide comprehensive and effective occupational therapy services. The CODA must navigate this discrepancy while respecting the client's autonomy and ensuring the chosen assessment tool is appropriate for the client's current needs and the identified goals. Correct approach analysis. Selecting the Canadian Occupational Performance Measure, COPM, is the best professional practice in this situation. The COPM is a client-centered outcome measure designed to identify and prioritize problems in the areas of self-care, productivity, and leisure. It directly addresses the client's perception of their performance and satisfaction with their performance in these areas. By using the COPM, the CODA is actively engaging the client in goal setting and ensuring that the occupational therapy intervention plan is directly aligned with what the client values and wants to achieve. This approach respects client autonomy and adheres to the principles of client-centered care, which are foundational to occupational therapy practice, as outlined in the College of Occupational Therapists of Ontario, CODO, Standards of Practice. The COPM focus on performance and satisfaction allows for a comprehensive understanding of the client's perceived occupational performance deficits and their desired outcomes, even if these differ from initial observations. Incorrect approaches analysis. Choosing the model of human occupation, MOHO, screening tool without further client input would be professionally unacceptable. While MOHO provides a framework for understanding the person, environment, and occupation, its screening tools are generally used to gather broad information about a client's occupational functioning, not to specifically prioritize or measure client-identified goals. Relying solely on a MOHO screening tool in this context would bypass the client's stated priorities and potentially lead to an intervention plan that does not address their most pressing concerns, violating the principle of client-centered care and potentially leading to ineffective therapy. Administering a standardized fine motor skills assessment without considering the client's stated goals would also be professionally unacceptable. Standardized assessments are valuable for measuring specific performance components, but their use must be justified by the client's goals or the therapist's clinical reasoning regarding underlying deficits. In this scenario, the client has not expressed a desire to improve fine motor skills, and the CODA observation of difficulty with meal preparation does not automatically necessitate a fine motor assessment as the primary intervention strategy. This approach risks imposing external goals rather than collaborating with the client, which is a deviation from ethical practice and the CODO standards of practice regarding client participation in goal setting. Focusing solely on the CODA, initial observations of difficulty with meal preparation, and designing an intervention plan without further assessment or client collaboration would be professionally unacceptable. While observations are crucial, they must be validated and prioritized through client input and appropriate assessment. This approach neglects the client's perspective and autonomy, potentially leading to an intervention plan that is not meaningful or motivating for the client. It also fails to gather specific data on the client's perceived performance and satisfaction, which are essential for establishing measurable goals and tracking progress, as emphasized in the CODO standards of practice. Professional reasoning. When faced with a discrepancy between client-stated goals and therapist observation, the professional decision-making process should prioritize client engagement and the selection of assessment tools that bridge this gap. This involves active listening to understand the client's perspective, using client-centered assessment tools to quantify and prioritize their goals, and then collaboratively developing an intervention plan that addresses both the client's priorities and identified functional limitations. The CODA must always operate within their scope of practice and adhere to the ethical and regulatory guidelines set forth by their governing body, ensuring that all interventions are client-centered, evidence-based, and respectful of client autonomy. Question 4. Governance review demonstrates that a certified occupational therapy assistant, CODA, is working with a client who has expressed a strong desire to return to a specific hobby that involves significant fine motor dexterity and prolonged standing. However, the CODA initial assessment, in collaboration with the supervising occupational therapist, OT, indicates that the client currently exhibits moderate tremor in their hands and significant fatigue after standing for more than 15 minutes, which are likely to impede their ability to safely and effectively engage in this hobby in the short term. The CODA is unsure how to proceed with goal setting and intervention planning. Which of the following approaches best aligns with regulatory and ethical guidelines for understanding client needs and goals in this context? Option A. Inform the client that their stated hobby goal is unrealistic given their current functional limitations and unilaterally set new, more achievable goals based on the CODA assessment. Option B. Avoid discussing the discrepancy between the client's stated goal and the assessment findings with the client or the supervising OT, and continue with general therapeutic activities without specific goal alignment. Option C. Proceed with interventions solely focused on the client's stated hobby goal, assuming the client's desire is the primary driver for therapy, and document the limitations as they arise during treatment. Option D. Initiate interventions focused on improving the client's fine motor control and endurance, while engaging the client in a discussion about modifying their hobby to be more achievable in the near future, and collaboratively setting intermediate goals that build towards their ultimate hobby goal. Correct answer is D. Initiate interventions focused on improving the client's fine motor control and endurance, while engaging the client in a discussion about modifying their hobby to be more achievable in the near future, and collaboratively setting intermediate goals that build towards their ultimate hobby goal. Explanation. This scenario presents a professional challenge because the Certified Occupational Therapy Assistant, CODA, is faced with conflicting information regarding a client's needs and goals. The client's stated goals, while important, may not fully align with the therapist's assessment of the client's functional limitations and potential for improvement. The CODA must navigate this discrepancy ethically and professionally, ensuring the client's autonomy is respected, while also providing evidence-based and effective occupational therapy services. This requires careful consideration of the client's capacity to understand their condition and the implications of their goals, as well as the therapist's responsibility to advocate for the client's well-being. The correct approach involves a collaborative discussion with the client and the supervising occupational therapist OT. This approach represents best professional practice because it upholds the principles of client-centered care, informed consent, and professional collaboration as outlined in the Occupational Therapy Code of Ethics and Practice Standards. Specifically, it respects the client's right to self-determination and participation in goal setting. By engaging in a dialogue with the client and the OT, the CODA can explore the underlying reasons for the client's stated goals, identify potential barriers to achieving them, and collaboratively redefine goals that are both meaningful to the client and therapeutically achievable. This process ensures that the intervention plan is tailored to the individual's unique circumstances and promotes optimal outcomes. An incorrect approach would be to proceed with interventions based solely on the client's stated goals without further exploration or consultation with the OT, even if the CODA perceives a discrepancy. This would be a failure to adhere to professional standards of practice that mandate a comprehensive assessment and collaborative goal setting. It could lead to ineffective interventions, client frustration, and a potential breach of the CODA duty of care. Another incorrect approach would be to dismiss the client's stated goals entirely and unilaterally impose goals based on the quota assessment. This disregards the client's autonomy and right to participate in their own care, violating ethical principles of respect for persons, and potentially leading to a breakdown in the therapeutic relationship. A third incorrect approach would be to avoid addressing the discrepancy and simply document the client's stated goals without any attempt to reconcile them with the OT's assessment or engage the client in further discussion. This represents a passive approach that fails to actively promote the client's well-being and could result in a lack of progress. The professional decision-making process for similar situations involves a systematic approach. First, recognize the discrepancy between the client's stated goals and the therapist's assessment. Second, consult the Occupational Therapy Code of Ethics and Practice Standards to guide ethical considerations, particularly regarding client autonomy, informed consent, and professional responsibility. Third, engage in open and empathetic communication with the client to understand their perspective and the rationale behind their goals. Fourth, collaborate with the supervising OT to discuss the assessment findings, the client's goals, and potential strategies for reconciliation. Finally, work collaboratively with the client and OT to establish mutually agreeable and therapeutically sound goals that promote the client's health and well-being. Question 5. The performance metrics show a consistent pattern of a young child exhibiting increased withdrawal during group play activities, often seeking solitary engagement and displaying minimal verbal interaction with peers. The supervising occupational therapist has requested a preliminary risk assessment to inform the next steps in the intervention plan. Which of the following approaches best guides the quota in contributing to this risk assessment? Option A. Focusing solely on the child's ability to complete fine motor tasks, as this is a primary area of occupational therapy focus, and deeming the social interactions as secondary. Option B. Interpreting the withdrawal as a definitive sign of a social anxiety disorder and suggesting a referral to a mental health specialist without further consultation. Option C. Immediately recommending a change in the intervention plan to focus solely on individual play to avoid further social discomfort for the child. Option D. Documenting the observed behaviors and consulting with the supervising occupational therapist to discuss potential implications and gather further information before proposing any interventions. The correct answer is D. Documenting the observed behaviors and consulting with the supervising occupational therapist to discuss potential implications and gather further information before proposing any interventions. Explanation. This scenario presents a professional challenge because it requires the certified occupational therapy assistant, COTA, to interpret performance data related to a child's social and emotional development and translate that into a risk assessment. This involves understanding subtle behavioral cues, considering the developmental context, and applying professional judgment within the established regulatory framework for occupational therapy practice. The quota must balance the need for intervention with the child's right to privacy and the importance of a supportive therapeutic environment. The correct approach represents best professional practice because it involves a systematic and evidence-informed process. It prioritizes gathering comprehensive information, including direct observation and input from the supervising occupational therapist, OT, and caregivers. This collaborative approach ensures that the risk assessment is holistic, accurate, and aligned with the child's individual needs and the established plan of care. Adhering to the scope of practice for a quota, which includes contributing to assessment under OT supervision, is paramount. This approach upholds ethical principles of beneficence and non-maleficence by ensuring interventions are appropriate and minimize potential harm. It also aligns with regulatory guidelines that mandate client-centered care and the use of evidence-based practices. Incorrect approaches fail to meet professional standards and may violate regulatory or ethical guidelines. One incorrect approach might involve making a definitive diagnosis or recommending specific interventions without sufficient data or OT supervision. This oversteps the quota scope of practice and could lead to inappropriate or ineffective treatment, violating the principle of competence and potentially causing harm. Another incorrect approach could be to dismiss observed behaviors as insignificant without further investigation or consultation. This neglects the potential for underlying social-emotional challenges and fails to act in the child's best interest, potentially violating the duty to advocate for the client. A third incorrect approach might involve solely relying on caregiver reports without independent observation or verification, which can lead to biased assessments and overlook critical behavioral indicators. This demonstrates a lack of professional diligence and a failure to gather comprehensive data, which is essential for accurate risk assessment. Professionals should approach such situations by first reviewing the available performance metrics and identifying any potential areas of concern related to social and emotional development. They should then consult with the supervising OT to discuss observations and collaboratively determine the next steps. This includes gathering additional information through direct observation, reviewing existing documentation, and communicating with caregivers. Based on this comprehensive data, the CODA, under OT guidance, can contribute to a risk assessment that informs the development or modification of the intervention plan. This iterative process of observation, consultation, assessment, and intervention ensures that the child receives appropriate and effective occupational therapy services. Question 6. Compliance review shows that during an initial occupational therapy evaluation, a client expresses a strong desire to expedite the process and requests that certain standardized assessments be omitted, stating they are unnecessary for their stated goals. The occupational therapist believes these omitted assessments are crucial for a complete understanding of the client's functional deficits and for developing an evidence-based intervention plan. What is the most appropriate course of action for the occupational therapist in this situation? Option A. Insist on conducting all initially planned assessments without deviation, informing the client that these are mandatory for compliance and effective treatment, regardless of their preferences. Option B. Inform the client that the evaluation cannot proceed if they refuse to complete all recommended assessments and suggest they seek services elsewhere. Option C. Explain to the client the rationale behind the recommended assessments, discuss the potential impact of omitting them on the effectiveness of the intervention plan, and collaboratively explore alternative ways to gather necessary information or adjust the evaluation timeline if appropriate, while ensuring all essential components are addressed. Option D. Proceed with the evaluation as requested by the client, omitting the assessments they deem unnecessary, to respect their autonomy and expedite the process. The correct answer is C. Explain to the client the rationale behind the recommended assessments, discuss the potential impact of omitting them on the effectiveness of the intervention plan, and collaboratively explore alternative ways to gather necessary information or adjust the evaluation timeline if appropriate, while ensuring all essential components are addressed. Explanation. This scenario presents a professional challenge because it involves a conflict between the client's expressed wishes and the occupational therapist's professional judgment regarding the necessity of a comprehensive evaluation. The occupational therapist must balance client autonomy with their ethical and legal responsibility to provide appropriate care, which includes ensuring the evaluation is thorough enough to inform effective interventions. The challenge lies in navigating this balance without alienating the client or compromising the quality of care. The correct approach represents best professional practice because it prioritizes client-centered care while upholding professional standards. By explaining the rationale behind the comprehensive evaluation and offering alternatives that still address the client's concerns, the occupational therapist demonstrates respect for the client's autonomy and their right to participate in decision-making. This approach aligns with the ethical principles of beneficence, acting in the client's best interest, and non-maleficence, avoiding harm by ensuring a complete understanding of the client's needs, as well as regulatory requirements for thorough and individualized evaluations. It also fosters trust and collaboration, which are essential for successful therapeutic outcomes. An incorrect approach that involves proceeding with a limited evaluation without adequate justification or client education would be professionally unacceptable. This would represent a failure to adhere to the regulatory framework's requirement for a comprehensive occupational therapy evaluation, which is the foundation for developing an effective intervention plan. It could also be seen as a violation of the ethical principle of fidelity, failing to act with integrity and honesty by not ensuring the evaluation meets professional standards. Furthermore, it risks providing suboptimal care due to incomplete information, potentially leading to ineffective interventions and a failure to meet the client's actual needs. Another incorrect approach, such as insisting on the full evaluation without acknowledging the client's concerns or offering any flexibility, would be professionally unacceptable. This demonstrates a lack of client-centeredness and potentially violates the principle of respect for persons, failing to acknowledge the client's right to self-determination. It could also lead to client dissatisfaction and non-adherence to the treatment plan, ultimately hindering progress. This approach fails to engage in collaborative decision-making, which is a cornerstone of ethical and effective occupational therapy practice. The professional decision-making process for similar situations should involve a systematic approach. First, clearly identify the client's stated needs and preferences. Second, assess the professional judgment regarding the necessary components of a comprehensive evaluation to address those needs effectively. Third, engage in open and honest communication with the client, explaining the rationale for the recommended evaluation process and its importance for achieving their goals. Fourth, explore potential compromises or alternative approaches that can still meet the core requirements of the evaluation while respecting the client's concerns. Finally, document the decision-making process, including the client's input and the rationale for the chosen course of action. Question 7. The assessment process reveals that a client who has a history of significant trauma expresses strong reservations about participating in a group therapy session focused on social interaction, citing a belief that such interactions could trigger their past traumatic experiences and negatively impact their mental well-being. The CODA is aware that group therapy is often utilized to improve social participation and reduce isolation. What is the most appropriate initial course of action for the CODA? Option A. Immediately inform the supervising occupational therapist that the client is refusing the recommended intervention and request that the OT handle the situation directly. Option B. Respectfully acknowledge the client's concerns, explore the specific nature of their fears related to the group setting, and discuss potential modifications or alternative strategies with the client and supervising occupational therapist. Option C. Proceed with the group therapy session as planned, explaining to the client that it is a standard intervention for social participation and that their concerns are likely unfounded. Option D. Gently but firmly explain to the client that their personal beliefs are not relevant to the therapeutic goals and that participation in the group is essential for their recovery. The correct answer is B. Respectfully acknowledge the client's concerns, explore the specific nature of their fears related to the group setting, and discuss potential modifications or alternative strategies with the client and supervising occupational therapist. Explanation. The assessment process reveals a client's deeply held personal beliefs that conflict with the recommended occupational therapy intervention. This scenario is professionally challenging because it requires the Certified Occupational Therapy Assistant, COTA, to balance the client's autonomy and right to self-determination with the professional's duty to provide evidence-based care and promote well-being. Navigating this requires a nuanced understanding of the historical philosophical underpinnings of occupational therapy, particularly the emphasis on client-centered practice and the recognition of individual values and beliefs. The correct approach represents best professional practice because it prioritizes a collaborative and respectful dialogue with the client. This aligns with the core philosophical tenets of occupational therapy, which have historically emphasized the importance of understanding the client's unique perspective, values, and goals. By engaging in open communication, exploring the client's concerns, and seeking to understand the rationale behind their beliefs, the COTA upholds the principle of client autonomy. This approach also allows for potential re-education or modification of the intervention plan in a way that respects the client's values while still aiming to achieve functional outcomes. This is consistent with ethical guidelines that mandate informed consent and respect for client dignity. An incorrect approach that involves proceeding with the intervention without addressing the client's concerns would be a significant ethical and regulatory failure. This disregards the client's right to make informed decisions about their own care, a fundamental principle in healthcare. It also fails to acknowledge the historical evolution of occupational therapy towards a more client-centered model, moving away from paternalistic approaches. Another incorrect approach, such as immediately deferring to the supervising occupational therapist, OT, without attempting any client-centered communication, might be seen as a failure to utilize the COTA skills in building rapport and facilitating understanding at the client's level. While consultation with the OT is crucial, it should follow an attempt to engage the client directly. A third incorrect approach, such as dismissing the client's beliefs as irrational or unimportant, is a direct violation of professional ethics and demonstrates a lack of respect for the individual, undermining the therapeutic relationship and the core values of the profession. Professional decision-making in such situations should involve a framework that begins with active listening and empathetic understanding of the client's perspective. This is followed by an exploration of the underlying reasons for their beliefs and concerns. The CODA should then clearly and respectfully explain the rationale for the recommended intervention, linking it to the client's stated goals and functional needs. If a significant conflict persists, the CODA should consult with the supervising OT, providing a clear and objective report of the client's concerns and the communication that has occurred. Together, the OT and CODA can then collaboratively develop a revised plan or explore alternative interventions that are both therapeutically sound and respectful of the client's values. Question 8. The control framework reveals that an occupational therapy assistant is working with a client who expresses strong cultural beliefs that conflict with the therapist's recommended home exercise program. The client believes that performing certain movements associated with the exercises could bring misfortune according to their spiritual practices. The occupational therapy assistant needs to determine the most appropriate course of action. Option A. Inform the client that their beliefs are not relevant to the physical rehabilitation process and proceed with the prescribed exercise program as planned. Option B. Suggest the client find a different occupational therapy assistant who may be more understanding of their cultural beliefs. Option C. Immediately discontinue the home exercise program and inform the supervising occupational therapist that the client is unwilling to participate due to personal beliefs. Option D. Engage in a respectful dialogue with the client to understand the specific nature of their beliefs and explore potential modifications to the exercise program that honor their cultural practices while still addressing therapeutic goals. The correct answer is D. Engage in a respectful dialogue with the client to understand the specific nature of their beliefs and explore potential modifications to the exercise program that honor their cultural practices while still addressing therapeutic goals. Explanation. Scenario analysis. This scenario presents a common challenge in occupational therapy where a client's personal beliefs and cultural practices may intersect with recommended therapeutic interventions. The professional challenge lies in balancing the client's autonomy and cultural identity with the therapist's ethical and professional responsibility to provide effective and evidence-based care. It requires sensitivity, cultural humility, and a collaborative approach to ensure the client feels respected and empowered in their treatment plan. Correct approach analysis. The correct approach demonstrates adherence to the core principles of occupational therapy, particularly client-centered care and respect for diversity. It aligns with ethical guidelines that mandate understanding and respecting a client's values, beliefs, and cultural background. By engaging in open dialogue, actively listening, and seeking to understand the client's perspective, the therapist builds trust and a therapeutic alliance. This collaborative process allows for the co-creation of a treatment plan that is both culturally congruent and therapeutically beneficial, respecting the client's right to self-determination. This approach upholds the foundational knowledge of occupational therapy by prioritizing the individual's occupational performance within their unique context. Incorrect approaches analysis. One incorrect approach involves dismissing the client's beliefs as irrelevant or a barrier to treatment. This violates the ethical principle of respect for persons and fails to acknowledge the client's lived experience, which is central to occupational therapy. Such an approach can lead to client disengagement, mistrust, and a breakdown of the therapeutic relationship, potentially resulting in non-adherence to the treatment plan. It also demonstrates a lack of cultural competence, a critical component of foundational occupational therapy knowledge. Another incorrect approach is to proceed with the intervention without fully understanding the client's perspective or attempting to integrate their beliefs. This can be perceived as disrespectful and may inadvertently cause distress or offense to the client. It disregards the client's autonomy and their right to make informed decisions about their care. Ethically, this is unacceptable as it prioritizes the therapist's agenda over the client's well-being and self-determination. A third incorrect approach might be to impose a solution that aligns with the therapist's understanding of best practice without exploring how it can be adapted to the client's cultural context. This reflects a deficit in understanding the dynamic interplay between culture, beliefs, and occupational engagement. It fails to recognize that best practice must be individualized and responsive to the client's unique needs and values. As emphasized in foundational occupational therapy principles, Professional reasoning. When faced with a conflict between a client's beliefs and recommended interventions, a professional decision-making process should involve 1. Active listening and empathy. Create a safe space for the client to express their beliefs and concerns without judgment. 2. Cultural humility. Acknowledge that you may not fully understand the client's cultural context and be open to learning from them. 3. Collaborative problem solving. Explore potential adaptations or alternative interventions that respect the client's beliefs while still addressing therapeutic goals. 4. Informed decision-making. Ensure the client fully understands the rationale behind different options and their potential outcomes. 5. Documentation. Record the discussion, the client's decision, and the rationale for the chosen course of action. Question 9. The monitoring system demonstrates that a certified occupational therapy assistant CODA is working with a client on a fine motor task designed to improve pincer grasp. During the session, the client expresses frustration and states, "I don't want to do this anymore. It's boring, and I'd rather try that other activity we did yesterday that involved stacking blocks." Which of the following actions best reflects a client-centered approach in this situation? Option A. Immediately stop the current activity and switch to the client's preferred block stacking activity without further discussion, as client preference is paramount. Option B. Continue with the current fine motor task as planned, explaining to the client that it is essential for their progress and that their preferences cannot dictate the treatment plan. Option C. Acknowledge the client's feelings, explore the reasons for their disinterest in the current activity, and collaboratively discuss potential modifications or alternative activities that still address the therapeutic goals. Option D. Document the client's refusal to participate and inform the supervising occupational therapist that the client is non-compliant with the treatment plan. The correct answer is C. Acknowledge the client's feelings, explore the reasons for their disinterest in the current activity, and collaboratively discuss potential modifications or alternative activities that still address the therapeutic goals. Explanation. This scenario is professionally challenging because it requires the certified occupational therapy assistant, CODA, to balance the established treatment plan with the client's evolving preferences and perceived needs, all while adhering to professional standards and regulatory guidelines. The core of client-centered practice lies in empowering the individual and respecting their autonomy, which can sometimes create tension with the therapist's clinical judgment or the documented plan of care. Careful judgment is required to ensure that the client's voice is heard and integrated without compromising safety or the efficacy of the occupational therapy intervention. The correct approach represents best professional practice because it prioritizes open communication and collaborative goal setting, which are foundational to client-centered care as outlined by the American Occupational Therapy Association, AOTA, Standards of Practice and Code of Ethics. Specifically, Principle 3 of the AOTA Code of Ethics emphasizes respecting the client's right to self-determination and autonomy. By actively listening to the client's concerns, validating their feelings, and exploring the reasons behind their expressed desire to change the activity, the CODA demonstrates a commitment to understanding the client's occupational needs and values. This collaborative process allows for a shared decision-making approach, where the CODA can then use their clinical expertise to adapt the activity or explore alternative interventions that align with both the client's goals and the therapeutic objectives, ensuring the intervention remains meaningful and effective. An incorrect approach that involves proceeding with the original activity without addressing the client's expressed discomfort or desire for change fails to uphold the ethical principle of respecting the client's autonomy and right to self-determination. This could be seen as a violation of the AOTA Code of Ethics, specifically Principle 3, by disregarding the client's expressed wishes and potentially leading to disengagement or a negative therapeutic experience. Furthermore, it neglects the principle of beneficence, Principle 1, as the intervention may no longer be beneficial if it is not aligned with the client's current priorities or if it causes distress. Another incorrect approach, such as immediately terminating the session or reporting the client's change of mind as non-compliance without further exploration, demonstrates a lack of understanding of client-centered practice and the dynamic nature of therapeutic relationships. This approach fails to acknowledge the client's right to express their preferences and can be perceived as punitive rather than therapeutic. It also misses an opportunity to understand the underlying reasons for the client's shift in preference, which could be crucial for effective intervention planning. Ethically, this could be viewed as a failure to provide appropriate care and support, potentially violating Principle 1 beneficence, and Principle 3, autonomy. The professional decision-making process for similar situations should involve a structured approach. 1. Active listening and validation. The coda must first listen attentively to the client's concerns, acknowledge their feelings, and validate their perspective. 2. Exploration and understanding. The coda should then explore the reasons behind the client's expressed desire for change, asking open-ended questions to gain a deeper understanding of their motivations, values, and perceived barriers. 3. Collaborative problem solving. Based on the understanding gained, the coda should engage in collaborative problem solving with the client. This involves discussing the original goals, the client's current preferences, and potential modifications or alternative activities that can achieve similar therapeutic outcomes while respecting the client's wishes. 4. Clinical judgment and adaptation. The coda then applies their clinical judgment to determine the feasibility and appropriateness of proposed adaptations or alternatives, ensuring they align with the client's overall treatment plan and safety considerations. 5. Documentation. All discussions, decisions, and adaptations should be clearly documented in the client's record. Question 10. Comparative studies suggest that when assisting an adult client with a new cognitive strategy for managing their finances, which approach is most likely to foster effective and lasting learning, considering principles of adult cognitive development and learning theories. Option A. Delivering a lengthy lecture explaining all aspects of the strategy at once, followed by a quiz to assess comprehension. Option B. Breaking down the strategy into small, manageable steps, providing opportunities for practice with immediate feedback, and gradually increasing the complexity as the client demonstrates mastery. Option C. Providing a simplified version of the strategy that omits certain details, assuming the client will ask questions if they need more information. Option D. Presenting the entire financial management strategy in a detailed manual and expecting the client to read and memorize it independently. The correct answer is B. Breaking down the strategy into small, manageable steps, providing opportunities for practice with immediate feedback, and gradually increasing the complexity as the client demonstrates mastery. Explanation. This scenario presents a professional challenge because the Certified Occupational Therapy Assistant, COTA, must apply theoretical knowledge of cognitive development and learning to a real-world client situation, ensuring interventions are evidence-based and ethically sound within the scope of practice. The COTA must consider the client's individual needs, the established treatment plan, and the principles of adult learning, all while adhering to the regulatory framework governing occupational therapy practice. The correct approach represents best professional practice because it prioritizes a client-centered, evidence-based intervention that aligns with established cognitive learning theories. Specifically, it leverages principles of scaffolding and zone of proximal development, which are foundational to effective skill acquisition in adults. This approach is supported by the regulatory framework, which mandates that occupational therapy services be provided in a manner that promotes client independence and maximizes functional outcomes, utilizing appropriate therapeutic modalities and interventions. The COTA role is to implement interventions designed by the occupational therapist OT, and this approach demonstrates understanding and application of those principles in a way that respects the client's learning style and pace. An incorrect approach that relies solely on rote memorization fails to acknowledge the complexities of adult learning and cognitive processing. This is ethically problematic as it may lead to ineffective interventions and frustration for the client, potentially hindering progress. Regulatory failure occurs because it does not align with the expectation that occupational therapy services are designed to promote meaningful participation and adaptation, rather than simply information recall. Another incorrect approach that focuses on presenting all information at once without considering the client's cognitive load or ability to process complex information is also problematic. This disregards principles of cognitive load theory and can overwhelm the client, leading to decreased learning and engagement. Ethically, this approach is a failure to provide appropriate and individualized care. From a regulatory standpoint, it does not meet the standard of care expected in occupational therapy, which requires tailoring interventions to the client's specific cognitive abilities and learning preferences. A third incorrect approach that assumes the client will learn passively without active engagement or opportunities for practice neglects key principles of active learning and experiential learning. This is ethically questionable as it limits the client agency in their own learning process. Regulatory failure arises from not employing strategies that foster active participation and skill generalization, which are core tenets of occupational therapy's goal to enhance functional performance in meaningful contexts. The professional decision-making process for similar situations involves a systematic approach. First, understanding the client's current cognitive status and learning preferences as assessed by the OT. Second, identifying the specific skills or knowledge to be acquired. Third, selecting theoretical frameworks, e.g., Vygotsky's sociocultural theory, Bandura's social cognitive theory, information processing models that best explain how the client learns and how to facilitate that learning. Fourth, designing or implementing interventions that are consistent with these theories and the OT's plan. And fifth, continuously evaluating the effectiveness of the intervention and making adjustments as needed, always within the quota scope of practice and under the supervision of the OT. Question 11. Assessment of a client with chronic pain and limited mobility reveals significant social isolation and a desire to reconnect with community activities. The occupational therapist has outlined a treatment plan focusing on enhancing the client's sense of self-efficacy and facilitating participation in meaningful roles. Which model of practice best guides the quota intervention selection in this scenario? Option A, the cognitive behavioral model. Option B, the biomechanical model. Option C, the model of human occupation MOHO. Option D, the rehabilitation model. Correct answer is C, the model of human occupation MOHO. Explanation. This scenario presents a professional challenge because the certified occupational therapy assistant, COTA, must select a model of practice that best aligns with the client's unique needs and the occupational therapist's overall treatment plan, while also adhering to the established scope of practice and ethical guidelines. The COTA role is to implement interventions based on the chosen model, requiring a nuanced understanding of how each model guides practice. The correct approach represents best professional practice because it demonstrates the COTA ability to critically analyze the client's situation and select the model that most effectively supports the client's engagement in meaningful occupations. This aligns with the core principles of occupational therapy, which emphasize client-centered care and the promotion of participation in life roles. By choosing a model that prioritizes the client's internal motivations and environmental influences, the COTA facilitates a holistic and empowering therapeutic experience, consistent with ethical obligations to promote client well-being and autonomy. An incorrect approach that focuses solely on the client's physical deficits without considering their psychosocial context or environmental barriers would be professionally unacceptable. This failure would violate ethical principles by not addressing the client holistically and could lead to ineffective interventions that do not promote meaningful occupational engagement. It also risks misinterpreting the OT's treatment plan, which is likely based on a broader understanding of occupational performance. Another incorrect approach that emphasizes external rewards or therapist-directed tasks without considering the client's intrinsic motivation or personal goals would also be professionally unacceptable. This approach neglects the client's autonomy and self-determination, which are fundamental to occupational therapy. It fails to foster the client's sense of agency and may lead to compliance rather than genuine engagement in occupations. A third incorrect approach that disregards the influence of the client's environment on their occupational performance would be professionally unacceptable. Occupational therapy recognizes the dynamic interplay between the person, environment, and occupation. Ignoring environmental factors can lead to interventions that are not transferable to the client's natural settings, limiting the effectiveness and sustainability of therapeutic outcomes. The professional decision-making process for similar situations involves 1. Thoroughly understanding the client's goals, values, and priorities as identified by the OT. 2. Analyzing the client's strengths and challenges across physical, cognitive, psychosocial, and environmental domains. 3. Identifying the underlying model of practice that the OT is utilizing or that best fits the client's needs. 4. Selecting interventions that are consistent with the chosen model and the quota scope of practice. 5. Continuously evaluating the effectiveness of interventions and collaborating with the OT to make necessary adjustments. Question 12. When evaluating a client who has been receiving therapeutic exercise for a post-surgical knee condition, and the client begins to report increased stiffness and a desire for more aggressive manual stretching techniques that were not part of the initial treatment plan developed by the supervising physical therapist, What is the most appropriate course of action for the certified occupational therapy assistant? Option A. Proceed with the more aggressive manual stretching techniques as requested by the client, assuming the client's subjective report indicates a need for a more intensive approach. Option B. Communicate these observations and the client's expressed desire for more aggressive manual stretching to the supervising physical therapist for further evaluation and potential adjustment of the treatment plan. Option C. Continue with the prescribed therapeutic exercises, focusing solely on the client's subjective report of pain relief and ignoring the expressed desire for more aggressive techniques. Option D. Advise the client to seek out a different type of therapy, such as deep tissue massage, without consulting the supervising physical therapist. The correct answer is B. Communicate these observations and the client's expressed desire for more aggressive manual stretching to the supervising physical therapist for further evaluation and potential adjustment of the treatment plan. Explanation. Scenario analysis. This scenario presents a common challenge for certified occupational therapy assistants, COTA, in the United States, specifically within the context of state practice acts and AOTA Occupational Therapy Practice Framework, OTF. The challenge lies in discerning the appropriate scope of practice when a client's needs extend beyond basic therapeutic exercise and into areas requiring the expertise of a licensed physical therapist, PT. The COTA must balance providing effective interventions with respecting the boundaries of their professional role and ensuring client safety and optimal outcomes, all while adhering to regulatory requirements. Correct approach analysis. The correct approach involves the COTA recognizing the limitations of their scope of practice as defined by the relevant state's Practice Act and AOTA guidelines. This means identifying when a client's condition or the required intervention necessitates the assessment and treatment planning by a PT. The COTA role is to implement interventions as directed by the supervising PT and to report observations and client progress. If the client's presentation suggests a need for a more advanced or specialized physical rehabilitation intervention, the COTA ethical and regulatory responsibility is to communicate these observations to the supervising PT for further evaluation and potential modification of the treatment plan. This aligns with the principle of client-centered care and ensures that the client receives the most appropriate level of professional expertise. Incorrect approaches analysis. Continuing with the advanced manual therapy techniques without a specific PT directive or assessment is a regulatory and ethical failure. State practice acts and AOTA guidelines clearly delineate the COTA role in implementing interventions, not independently initiating or modifying them beyond their scope. This could be construed as practicing beyond the scope of licensure, potentially endangering the client, and violating the supervisory relationship with the PT. Recommending the client seek a different therapy modality without consulting the supervising PT is also problematic. While the COTA may observe a need for a different approach, unilaterally suggesting it bypasses the established interprofessional collaboration model. The PT is responsible for the overall treatment plan, and any recommendations for significant changes should be channeled through them. This failure undermines the collaborative nature of care and the PT's supervisory role, focusing solely on the client's subjective report of pain relief without objectively assessing the underlying cause or the effectiveness of the intervention in addressing the functional deficit is an incomplete approach. While subjective reports are important, the COTA must also consider objective findings and the overall goals of therapeutic exercise and physical rehabilitation, which extend beyond symptom management to functional improvement. This can lead to a superficial treatment that does not address the root cause of the client's limitations, potentially delaying recovery or leading to ineffective interventions. Professional reasoning. Professionals should utilize a decision-making framework that prioritizes client safety, adheres to regulatory mandates, state practice acts, and follows professional ethical guidelines, AOTA Code of Ethics. This involves 1. Understanding one's own scope of practice and limitations. 2. Recognizing when a client's needs exceed that scope. 3. Communicating observations and concerns to the supervising PT promptly and clearly. 4. Collaborating with the PT to ensure the client receives appropriate and effective care. 5. Documenting all observations and communications accurately. Question 13. Operational review demonstrates a client with a recent diagnosis of mild cognitive impairment expresses a strong desire to resume gardening, a cherished occupation. The client's family expresses concern about the client's safety due to potential forgetfulness regarding tool usage and the risk of falls in the garden. The CODA is tasked with evaluating the feasibility of this activity. Which of the following represents the most appropriate initial approach for the CODA? Option A. Conduct a comprehensive activity analysis of gardening. Identify potential risks related to the client's cognitive impairment and the physical environment, and propose specific, client-centered adaptations to mitigate these risks, documenting the assessment and proposed interventions. Option B. Advise the client and family that gardening is too risky given the cognitive impairment and recommend alternative, less demanding sedentary activities to ensure safety. Option C. Allow the client to garden independently without any modifications, trusting that the client will exercise caution and learn from any mistakes. Option D. Immediately implement a strict supervision protocol for all gardening activities, requiring constant observation by a caregiver to prevent any potential incidents. The correct answer is A. Conduct a comprehensive activity analysis of gardening. Identify potential risks related to the client's cognitive impairment and the physical environment, and propose specific, client-centered adaptations to mitigate these risks, documenting the assessment and proposed interventions. Explanation. This scenario presents a professional challenge because it requires the Certified Occupational Therapy Assistant, COTA, to balance the client's desire for independence with the inherent risks associated with a potentially unsafe activity. The COTA must apply a systematic risk assessment approach to ensure client safety while still promoting meaningful engagement and occupational participation. This requires careful consideration of the client's current abilities, the demands of the activity, and the environmental context. The correct approach involves a thorough risk assessment that identifies potential hazards, analyzes the likelihood and severity of harm, and implements appropriate adaptations or modifications to mitigate those risks. This aligns with the ethical principles of beneficence, acting in the client's best interest, and non-maleficence, avoiding harm, as well as the regulatory framework that mandates safe and effective occupational therapy services. By systematically evaluating the risks and developing a plan to address them, the COTA upholds their professional responsibility to provide client-centered care that prioritizes safety without unnecessarily restricting participation. An incorrect approach would be to immediately dismiss the client's request due to perceived risk without a formal assessment. This could be considered a failure to uphold the principle of client autonomy and could lead to a loss of trust and engagement. Another incorrect approach would be to allow the client to engage in the activity without any modifications or safety considerations, which would violate the duty to prevent harm and could result in injury, leading to potential regulatory sanctions and ethical breaches. Failing to document the risk assessment and the rationale for any decisions made would also be a regulatory and ethical failure, as it compromises accountability and transparency in client care. Professionals should approach such situations by first actively listening to the client's goals and desires. Then, they should conduct a comprehensive activity analysis, breaking down the task into its component parts. Following this, a risk assessment should be performed, considering the client's physical, cognitive, and psychosocial status in relation to the activity demands and the environment. Based on this assessment, the COTA, in collaboration with the supervising occupational therapist, OT, should determine if the activity can be safely performed, and if not, what adaptations or modifications are necessary to enable safe participation. This collaborative and systematic process ensures that client goals are addressed while maintaining a high standard of care and safety. Question 14. Operational review demonstrates that a Certified Occupational Therapy Assistant, COTA, is working with a client who has expressed a desire for their adult children to be more involved in their rehabilitation process. The COTA needs to determine the most appropriate next step to facilitate this involvement while upholding professional standards and client rights. Which of the following approaches best reflects best practice in this situation? Option A. Assume that the client's desire for involvement means they are comfortable with the COTA sharing all treatment details and strategies with their children without further discussion. Option B. Immediately contact the client's adult children to inform them about the client's progress and invite them to attend the next therapy session to discuss how they can help. Option C. Inform the client that while family involvement can be helpful, the COTA primary focus is on direct client care, and that family participation is not a core component of the intervention plan. Option D. Discuss with the client their specific goals for family involvement and obtain their explicit consent to share relevant information and involve their children in treatment planning and goal setting. The correct answer is D. Discuss with the client their specific goals for family involvement and obtain their explicit consent to share relevant information and involve their children in treatment planning and goal setting. Explanation. This scenario presents a common challenge in occupational therapy practice, balancing the client's autonomy and privacy with the need for effective support from their family or caregivers. The Certified Occupational Therapy Assistant, COTA, must navigate the ethical and regulatory landscape to ensure that family involvement enhances, rather than hinders, the client's progress and respects their rights. The professional challenge lies in gathering sufficient information to make informed decisions about the extent and nature of caregiver involvement, while always prioritizing the client's well-being and confidentiality. The correct approach represents best professional practice because it prioritizes obtaining explicit client consent before involving family members in treatment discussions or planning. This aligns with fundamental ethical principles of autonomy and confidentiality, as well as regulatory requirements that protect client privacy. By seeking consent, the COTA empowers the client and ensures that their wishes are respected, fostering a trusting therapeutic relationship. This approach also allows for a tailored strategy for caregiver involvement, ensuring it is beneficial and appropriate for the client's specific needs and goals. An incorrect approach that involves sharing client information with family members without explicit consent violates the client's right to privacy and confidentiality. This is a direct contravention of regulations such as the Health Insurance Portability and Accountability Act, HIPAA, in the United States, which mandates strict protections for protected health information, FI. Ethically, this breaches the trust placed in the therapist and can lead to significant harm to the client's relationships and well-being. Another incorrect approach, which assumes family involvement is always beneficial and proceeds without assessing the client's readiness or desire for such involvement, fails to recognize the client's autonomy. Family support can be invaluable. It is not universally applicable or desired by all clients. Forcing or assuming involvement can create resentment, undermine the client's sense of control, and potentially lead to conflict within the family or between the client and the therapeutic team. This approach neglects the individualized nature of occupational therapy and the importance of client-centered care. Finally, an approach that limits caregiver involvement solely to logistical support, without exploring their potential role in reinforcing therapeutic strategies or providing emotional support, while not directly violating privacy, misses a significant opportunity to enhance client outcomes. Best practice involves a collaborative assessment of how caregivers can best contribute to the client's goals, within the boundaries of the client's consent and comfort level. This approach is less about ethical failure and more about suboptimal practice that could limit the effectiveness of the occupational therapy intervention. The professional decision-making process for similar situations should begin with a clear understanding of the client's current situation, their goals, and their expressed wishes regarding family involvement. The COTA should then assess the potential benefits and risks of involving family members, always prioritizing client confidentiality and autonomy. Obtaining informed consent is a critical step, followed by a collaborative discussion with the client about the most appropriate ways to involve their support system. Regular reevaluation of the effectiveness and appropriateness of caregiver involvement is also essential. Question 15. Upon reviewing client interactions, a certified occupational therapy assistant, COTA, notices a client frequently shares personal anecdotes and asks about the COTA personal life, seemingly seeking a more personal connection beyond the therapeutic context. The COTA has been responding with brief, professional acknowledgments, but feels the client's attempts are becoming more persistent. Which of the following approaches best upholds the ethical and regulatory standards for a COTA in managing this therapeutic relationship? Option A. Reciprocate some personal disclosures to build rapport and show empathy, as this can strengthen the therapeutic alliance. Option B. Acknowledge the client's personal sharing, but then immediately change the subject to something unrelated to avoid any perceived personal connection. Option C. Gently redirect the conversation back to the client's occupational goals and therapeutic activities while maintaining a warm and professional demeanor. Option D. Engage in casual conversation that mirrors a friendship, as this can make the client feel more comfortable and less intimidated by the therapeutic setting. The correct answer is A. Reciprocate some personal disclosures to build rapport and show empathy, as this can strengthen the therapeutic alliance. Explanation. This scenario presents a common challenge in occupational therapy practice, navigating the boundaries of a therapeutic relationship while maintaining professional objectivity and client well-being. The Certified Occupational Therapy Assistant, COTA, must balance the need for rapport and trust with the ethical imperative to avoid dual relationships that could compromise care. The professional challenge lies in recognizing subtle shifts in the relationship dynamic and responding appropriately to prevent exploitation or harm. The correct approach emphasizes establishing and maintaining clear professional boundaries. This aligns with the ethical principles and practice standards for COTA, which mandate that the therapist's primary responsibility is to the client's welfare. Building trust and rapport are essential components of effective therapy, but these should be achieved through professional engagement, active listening, and demonstrating competence, not through personal disclosures or blurring of roles. Regulatory frameworks, such as those governing the practice of occupational therapy, consistently advocate for a professional stance that prioritizes the client's needs and avoids situations that could lead to conflicts of interest or compromise the therapeutic alliance. This approach ensures that the COTA remains an objective facilitator of the client's occupational goals. An incorrect approach involves reciprocating personal disclosures from the client. This blurs the professional boundary, potentially shifting the focus from the client's needs to the therapist's own experiences. Ethically, this can lead to a dual relationship, where the therapist's personal life becomes entangled with the professional one, compromising objectivity and potentially leading to exploitation of the client's trust. Regulatory guidelines strictly prohibit such actions as they undermine the integrity of the therapeutic relationship and can be detrimental to the client's progress and safety. Another incorrect approach is to dismiss the client's attempts at personal connection without acknowledging their underlying need for rapport. Maintaining boundaries is crucial. A complete dismissal can alienate the client, damage trust, and hinder the therapeutic process. The ethical failure here is a lack of sensitivity to the client's communication, potentially leading to a breakdown in the therapeutic alliance. Professional practice requires a balance of firmness in boundaries with empathy and understanding of the client's perspective. A further incorrect approach is to engage in overly casual conversation that mimics a friendship. While some level of informal interaction can be appropriate to build rapport, excessive casualness can lead the client to perceive the relationship as non-professional, potentially leading to unrealistic expectations or a misunderstanding of the therapist's role and responsibilities. This can create an environment where the client feels entitled to personal favors or a level of intimacy that is inappropriate and unethical. The professional decision-making process in such situations involves a continuous assessment of the therapeutic relationship. COTA should be aware of their ethical obligations and regulatory requirements. When faced with a situation where boundaries might be tested, they should ask themselves, does this action benefit the client's therapeutic goals? And does this action maintain professional objectivity and avoid a dual relationship? If the answer to either question is uncertain or negative, the COTA should err on the side of caution, consult with their supervising occupational therapist, and reinforce professional boundaries in a sensitive and client-centered manner. Question 16. During the evaluation of a new client for occupational therapy services, the client expresses a strong desire to focus solely on their ability to bathe independently, stating it is their primary concern. The Certified Occupational Therapy Assistant, COTA, understands that a comprehensive assessment of activities of daily living ADL and instrumental activities of daily living IADL is typically required. What is the most appropriate approach for the COTA to take in this situation? Option A. Focus the entire assessment on the client's ability to bathe independently, as per their direct request, and defer any assessment of other ADLs or IADL to a later date or follow-up session. Option B. Proceed with a full, comprehensive assessment of all ADLs and IADL without acknowledging or discussing the client's specific request about bathing, as the standard protocol must be followed. Option C. Explain to the client the importance of assessing a wider range of ADLs and IADL to ensure all potential challenges to their independence are identified, and collaboratively plan the assessment to address their primary concern while also covering other essential areas. Option D. Inform the client that their request to focus only on bathing is not feasible, as occupational therapy requires a complete assessment of all daily living activities, and proceed with the full assessment regardless of their input. The correct answer is C. Explain to the client the importance of assessing a wider range of ADLs and IEDL to ensure all potential challenges to their independence are identified, and collaboratively plan the assessment to address their primary concern while also covering other essential areas. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the Certified Occupational Therapy Assistant, COTA, to balance the client's stated preferences with the objective need for a comprehensive functional assessment. The client's desire to focus solely on bathing might stem from a variety of factors, including fatigue, embarrassment, or a misunderstanding of the assessment's purpose. The COTA must navigate this by respecting client autonomy while ensuring the assessment meets professional standards and regulatory requirements for a thorough evaluation of activities of daily living, ADL, and instrumental activities of daily living, IEDL. Correct approach analysis. The correct approach represents best professional practice because it prioritizes a holistic and client-centered evaluation that adheres to the scope of practice for occupational therapy. By explaining the rationale behind assessing a broader range of ADLs and IEDL, the COTA educates the client and fosters collaboration. This approach aligns with regulatory frameworks that mandate comprehensive evaluations to identify all functional deficits and strengths, enabling the development of an effective and individualized treatment plan. It respects the client's immediate concern while ensuring the assessment's integrity and utility, promoting optimal outcomes and client safety. This aligns with ethical principles of beneficence and non-maleficence by ensuring all relevant areas are considered for the client's well-being. Correct approaches analysis. Focusing solely on bathing as requested by the client, without further exploration or explanation, would be a regulatory and ethical failure. It neglects the COTA responsibility to conduct a comprehensive assessment as outlined by occupational therapy practice standards. This could lead to missed functional deficits in other critical ADLs or IEDL, potentially compromising the client's safety and independence in areas not addressed. It also fails to uphold the principle of providing the most beneficial care by not gathering all necessary information. Suggesting the client can address other areas later without a proper initial assessment is also professionally unacceptable. This approach delays the identification of potential issues in other ADL/IEDL, which could worsen over time or lead to secondary complications. It undermines the systematic and thorough nature of occupational therapy evaluations, potentially violating regulatory requirements for a complete assessment before initiating interventions. Dismissing the client's request and proceeding with a full assessment without acknowledging or addressing their stated preference is a failure in client-centered care and communication. While a comprehensive assessment is necessary, ignoring the client's input can erode trust and lead to resistance in therapy. This approach may not align with ethical guidelines that emphasize respecting client autonomy and fostering a collaborative therapeutic relationship. It could also be seen as a failure to adequately gather information about the client's priorities, which are an important component of treatment planning. Professional reasoning. Professionals should employ a client-centered approach that integrates client preferences with professional judgment and regulatory requirements. The decision-making process involves 1. Actively listening to and acknowledging the client's stated needs and preferences. 2. Educating the client about the purpose and scope of the assessment, explaining why a broader evaluation is beneficial for their overall well-being and independence. 3. Collaboratively determining the best approach to the assessment, potentially prioritizing areas of concern while ensuring all essential ADLs and IEDL are addressed. 4. Documenting the rationale for the assessment plan and any deviations or client agreements. This ensures both client satisfaction and adherence to professional standards and regulations. Question 17. Quality control measures reveal that a certified occupational therapy assistant, COTA, is implementing an intervention plan developed by an occupational therapist, OT, for a client with a goal of improving fine motor skills for dressing. The client expresses that they would prefer to focus on a different activity, stating it is more enjoyable and they believe it will help them more. The COTA is aware of the OT's rationale for the chosen intervention, which is based on specific deficits identified during the evaluation. What is the most appropriate course of action for the COTA in this situation, adhering to the occupational therapy practice framework, OT, and relevant U.S. regulations. Option A. Unilaterally modify the intervention to exclusively focus on the client's preferred activity, as client satisfaction is paramount and the quota should adapt to meet immediate client desires. Option B. Proceed with the intervention as planned by the OT, as the quota role is to implement the established plan, and the client's preference may not align with therapeutic necessity. Option C. Inform the client that their preference cannot be accommodated and insist on performing the OT's prescribed intervention without further discussion to maintain the integrity of the treatment plan. Option D. Engage the client in a discussion about their preferences and the rationale behind the OT's intervention, seeking to understand their perspective and collaboratively problem solve to ensure the intervention is meaningful and achievable. The correct answer is D. Engage the client in a discussion about their preferences and the rationale behind the OT's intervention, seeking to understand their perspective and collaboratively problem solve to ensure the intervention is meaningful and achievable. Explanation. This scenario presents a professional challenge because it requires the Certified Occupational Therapy Assistant, COTA, to navigate the ethical and regulatory landscape of client care while adhering to the Occupational Therapy Practice Framework, OTF. The challenge lies in balancing the client's expressed desires with the quota professional judgment and the established scope of practice, all within the regulatory framework governing occupational therapy in the United States. Careful judgment is required to ensure client autonomy is respected while also upholding professional responsibilities and safety. The correct approach represents best professional practice because it prioritizes a collaborative and client-centered process. By engaging the client in a discussion about their goals and the rationale behind the proposed intervention, the COTA upholds the principles of informed consent and client autonomy, which are foundational ethical and regulatory requirements. This approach aligns with the OTF emphasis on the therapeutic relationship and the collaborative development of interventions. It also demonstrates the COTA commitment to evidence-based practice by seeking to understand the client's perspective and tailoring the intervention accordingly, ensuring it is meaningful and achievable for the client. This fosters trust and promotes adherence to the treatment plan. An incorrect approach that involves proceeding with the intervention without further discussion fails to respect client autonomy and informed consent. This could lead to a situation where the client feels unheard or that the intervention is not relevant to their needs, potentially resulting in non-compliance and a compromised therapeutic outcome. Ethically, this violates the principle of respecting persons. Regulationally, it could be seen as a failure to provide appropriate care and obtain proper consent. Another incorrect approach, which involves unilaterally modifying the intervention to solely address the client's stated preference without considering the underlying therapeutic rationale or potential impact on overall functional goals, is also professionally unacceptable. While it appears to be client-centered, it risks undermining the occupational therapist's OT plan and potentially leading to an intervention that is not evidence-based or that does not effectively address the client's occupational deficits as identified by the OT. This could be considered practicing beyond the scope of the quota delegated responsibilities if it deviates significantly from the OT's established plan without consultation. Ethically, it could lead to suboptimal care and a failure to achieve desired outcomes. A professional decision-making process for similar situations should involve a clear understanding of the OTF domains and process, including the client's role in the intervention process. The quota should first seek to understand the client's perspective and their reasoning behind their stated preference. This should be followed by a collaborative discussion with the client, explaining the rationale behind the OT's proposed intervention and how it aligns with their overall goals. If there is a significant discrepancy, the quota should consult with the supervising OT to discuss the client's concerns and collaboratively determine the best course of action, which may involve modifying the intervention or re-evaluating the client's goals. This ensures that care is both client-centered and therapeutically sound, adhering to all regulatory and ethical standards. Question 18. Consider a scenario where a certified occupational therapy assistant, COTA, is working with an elderly client from a specific cultural background who expresses significant discomfort and reluctance to participate in a recommended home exercise program due to deeply held spiritual beliefs about the body and healing. The COTA has explained the purpose and benefits of the exercises, but the client remains steadfast in their refusal. Citing these beliefs, what is the most appropriate course of action for the COTA? Option A. Discuss the client's concerns with the supervising occupational therapist to collaboratively explore alternative or modified intervention that align with the client's cultural beliefs and therapeutic goals. Option B. Inform the client that their beliefs are not compatible with the prescribed treatment and suggest they seek services elsewhere if they cannot comply. Option C. Ignore the client's stated beliefs and focus solely on the physical aspects of the exercises, assuming the client will eventually comply for the sake of their physical health. Option D. Proceed with demonstrating and encouraging the exercises as prescribed, emphasizing their importance for recovery and gently reiterating that these are standard therapeutic procedures. The correct answer is A. Discuss the client's concerns with the supervising occupational therapist to collaboratively explore alternative or modified interventions that align with the client's cultural beliefs and therapeutic goals. Explanation. This scenario presents a professional challenge because the Certified Occupational Therapy Assistant, COTA, is encountering a cultural belief that directly conflicts with the recommended therapeutic intervention. The challenge lies in balancing the client's autonomy and cultural identity with the COTA professional responsibility to provide effective and safe occupational therapy services. Careful judgment is required to navigate this conflict without alienating the client or compromising their well-being. The correct approach represents best professional practice because it prioritizes client-centered care and cultural humility. By actively seeking to understand the client's beliefs and involving the occupational therapist in the decision-making process, the COTA demonstrates respect for the client's cultural background and upholds ethical principles of autonomy and beneficence. This collaborative approach ensures that interventions are not only clinically sound, but also culturally sensitive and acceptable to the client, aligning with the AOTA Occupational Therapy Code of Ethics and Standards of Practice, which emphasize respecting the client's right to self-determination and engaging in culturally responsive practice. An incorrect approach that involves proceeding with the intervention without addressing the cultural concern would be a failure to uphold the ethical principle of respect for autonomy. It disregards the client's right to make informed decisions about their care based on their values and beliefs. This could lead to client non-adherence, mistrust, and a breakdown in the therapeutic relationship, violating the COTA duty to promote client well-being. Another incorrect approach, such as dismissing the client's beliefs as irrelevant or misinformed, demonstrates a lack of cultural competence and humility. This is ethically problematic as it devalues the client's lived experience and cultural identity. It also fails to adhere to the professional expectation of seeking to understand diverse perspectives, which is crucial for effective therapeutic engagement. Such an approach could be seen as discriminatory and unprofessional, potentially violating ethical guidelines related to non-discrimination and respect for persons. A further incorrect approach, such as immediately terminating services due to the perceived impasse, would be an abdication of professional responsibility. While ethical considerations are paramount, the initial response should be to explore solutions and collaborate with the client and the OT. Abandoning the client without exploring all avenues for culturally sensitive intervention would be a failure to act in the client's best interest and could be considered a breach of professional duty. The professional decision-making process for similar situations should involve a systematic approach. 1. Recognize and acknowledge the cultural difference. 2. Actively listen to and seek to understand the client's perspective and the underlying cultural beliefs. 3. Consult with the supervising occupational therapist to discuss the situation and explore potential modifications to the intervention plan. 4. Collaborate with the client and the OT to develop a mutually agreeable plan that respects cultural values while still addressing the client's occupational needs. 5. Document all discussions, decisions, and the rationale behind the chosen course of action. Question 19. The review process indicates that a client with a recent diagnosis of progressive neurological impairment is experiencing increasing difficulty with meal preparation and self-feeding. The Certified Occupational Therapy Assistant, COTA, is tasked with exploring assistive technology and adaptive equipment options to support the client's independence and safety. Which of the following approaches best reflects a process-optimized and client-centered strategy for addressing this need? Option A. Suggest the client research and purchase adaptive eating utensils online, as this is a common and readily available solution for individuals with similar challenges. Option B. Implement a variety of adaptive kitchen tools and utensils that have been previously successful with other clients, without further individual assessment. To expedite the intervention process, option C, recommend and provide a specialized electric can opener and a set of weighted utensils based on the client's initial verbal request for assistance with these specific items. Option D, conduct a comprehensive functional assessment of the client's current abilities and limitations in meal preparation and self-feeding. Collaborate with the supervising occupational therapist to identify appropriate equipment based on evidence and client goals, and provide thorough training and follow-up to ensure safe and effective use. The correct answer is C. Recommend and provide a specialized electric can opener and a set of weighted utensils based on the client's initial verbal request for assistance with these specific items. Explanation: this scenario presents a common challenge in occupational therapy practice, ensuring the appropriate and safe use of assistive technology and adaptive equipment for a client with evolving needs. The professional challenge lies in balancing the client's immediate functional goals with long-term safety, efficacy, and adherence to established practice standards. Careful judgment is required to select, implement, and monitor interventions that are evidence-based and client-centered. The correct approach represents best professional practice because it prioritizes a systematic, client-centered, and collaborative process. This involves a thorough assessment of the client's current needs, functional abilities, and environment, followed by the selection of appropriate assistive technology or adaptive equipment based on evidence and client goals. Crucially, it includes comprehensive training for the client and/or caregivers, ongoing monitoring of effectiveness and safety, and a willingness to adjust the intervention as needed. This aligns with the ethical principles of beneficence, acting in the client's best interest, and non-maleficence, avoiding harm, as well as the regulatory requirement to provide competent and appropriate care. The Certified Occupational Therapy Assistant, COTA, is expected to work under the supervision of an occupational therapist (OT) and contribute to the development and implementation of the treatment plan, ensuring that all interventions are safe and effective. An incorrect approach that involves immediately providing a complex piece of equipment without a thorough assessment fails to adhere to professional standards and regulatory expectations. This could lead to the equipment being inappropriate, unsafe, or even detrimental to the client's progress, violating the principle of non-maleficence. Furthermore, it bypasses the essential collaborative process with the supervising OT, potentially leading to a fragmented or ineffective treatment plan. Another incorrect approach, such as relying solely on the client's initial request for a specific device without independent professional judgment or assessment, neglects the COTA responsibility to apply their knowledge and skills. This can result in the selection of equipment that does not truly meet the underlying functional deficit or may introduce new safety risks, contravening the duty of care. Finally, an approach that involves implementing equipment without adequate training or follow-up fails to ensure the client can use the device safely and effectively. This can lead to frustration, non-adherence, and potential injury, demonstrating a lack of professional diligence and potentially violating regulatory requirements for competent service delivery. The professional decision-making process for similar situations should involve a structured approach. 1. Initiate a comprehensive assessment of the client's needs, goals, and environmental context. 2. Collaborate with the supervising OT to develop a treatment plan that includes appropriate assistive technology or adaptive equipment recommendations. 3. Select equipment based on evidence, client suitability, and safety considerations. 4. Provide thorough training and education to the client and/or caregivers on the proper use, maintenance, and safety precautions of the equipment. 5. Implement a plan for ongoing monitoring and evaluation of the equipment's effectiveness and the client's safety. 6. Be prepared to modify or discontinue the intervention based on client progress, changes in needs, or emerging safety concerns, always in consultation with the supervising OT. Question 20. Which approach would be most appropriate for an occupational therapy assistant (OTA) to utilize when conducting an initial assessment with a client experiencing significant pain and fatigue, aiming to gather comprehensive information about their functional abilities and limitations? Option A. Administer a full battery of standardized tests immediately to ensure all areas are covered efficiently. Option B. Begin with simpler, less demanding tasks and gradually progress to more complex activities, observing the client's responses and adjusting the assessment as needed. Option C. Postpone the assessment until the client reports feeling completely pain-free and energetic. Option D. Rely solely on the client's self-report of their abilities and difficulties without direct observation. The correct answer is B. Begin with simpler, less demanding tasks and gradually progress to more complex activities, observing the client's responses and adjusting the assessment as needed. Explanation. Scenario analysis. This scenario presents a professional challenge in balancing the need for comprehensive assessment with the client's immediate functional limitations and potential for fatigue. An occupational therapy assistant, OTA, must exercise careful judgment to ensure the evaluation process is both thorough and client-centered, avoiding undue stress or exacerbation of symptoms. The OTA must consider the client's current state and adapt the assessment strategy accordingly, adhering to ethical principles of beneficence and non-maleficence. Correct approach analysis. The correct approach represents best professional practice because it prioritizes the client's well-being and functional capacity during the assessment. By starting with simpler, less demanding tasks and gradually progressing to more complex ones, the OTA can gather meaningful data without overwhelming the client. This method allows for observation of performance across a range of activities, providing a more accurate picture of the client's abilities and limitations in a safe and controlled manner. This aligns with the AOTA Occupational Therapy Practice Framework, Domain and Process, 4th ed., which emphasizes client-centered care and the use of meaningful occupations in assessment. It also adheres to the principle of providing services that are within the OTA's scope of practice and under the supervision of an occupational therapist (OT). Incorrect approaches analysis. One incorrect approach would be to administer a standardized battery of tests without regard for the client's current fatigue level or pain. This fails to consider the client's immediate needs and could lead to inaccurate results due to the client's compromised state, violating the principle of beneficence by potentially causing distress or harm. It also disregards the importance of observing the client's performance in a naturalistic or functional context, which is a cornerstone of occupational therapy. Another incorrect approach would be to solely rely on the client's verbal report of their abilities without direct observation or functional assessment. While subjective reports are valuable, they do not provide objective data on performance or the underlying factors affecting function. This approach risks an incomplete or inaccurate understanding of the client's occupational performance deficits, potentially leading to an inappropriate intervention plan. It also fails to utilize the OTA skills in observing and analyzing performance during meaningful tasks. A third incorrect approach would be to postpone the assessment indefinitely due to the client's current discomfort. While client comfort is important, a complete refusal to assess without attempting any modifications or alternative strategies is not professionally sound. Occupational therapy aims to improve function despite limitations, and a skilled OTA, in collaboration with an OT, can adapt assessment methods to accommodate temporary or ongoing challenges. This approach could delay necessary services and hinder the client's progress. Professional reasoning. Professionals should employ a client-centered, adaptive assessment process. This involves understanding the client's goals, current status, and potential barriers to participation. The OTA should collaborate with the supervising OT to select and administer appropriate assessment tools and strategies, modifying them as needed based on the client's response. This iterative process ensures that the assessment is both valid and reliable, while also being safe and respectful of the client's dignity and comfort. Decision-making should be guided by the AOTA Code of Ethics and Standards of Practice, emphasizing competence, integrity, and client welfare.